Welcome to this episode of Doctor-Patient Conversations on a very important and vast topic of bone and joint health. We have with us today two expert doctors who have contributed a lot to the society and to patients, Dr. Sudipta Bandyopadhyay and Dr. Somnath Chaudhary, who have both been 20 to 30 years in this field. And we are grateful to their expertise and answering the questions that I, Nadira Chaturvedi, will bring in the form of a patient's voice, and doctors will answer us patiently and carefully. Thank you, doctor, and welcome. To introduce I just didn't want to introduce Dr. Sudipta Bandyopadhyay has been a doctor since 1994, which makes it over 31 years, and is presently with HP Ghosh Hospital as a visiting consultant, whereas Dr. Somnath Chaudhary is not far behind with 21 years experience and is also working in the same hospital of HP Ghosh Hospital. Thank you and welcome, doctors, to this conversation. Our very first question to you is, although we have 206 bones in our body, we barely think of them and we take it for granted until we have pain or discomfort or an injury. Is it only because of this, or is there something that happens gradually that we are not aware that makes our bones dangerous or weak?
It's a very interesting question. There are a lot of bones in our body and we are not aware of any of them, but only we get the awareness when the bone pains, right? That is your question.
That's right.
The bone pain is basically originating from two reasons, mostly because of injury and secondly, different types of diseases. So injury-related bone pains are usually definitely acute in onset and it occurs with injury. So there is a direct causative relation between the injury and the pain. So the patient is often diagnose the cause of pain by themselves, and so they usually go to the doctor very promptly because there is an injury. But what is more being neglected is chronic sort of bone pain. Mostly the bone and joint pain, which occurs in the latter part of life, in the a little bit of older age. The patient starts having, say, for example, having a pain around the knee. The patient is having a problem in getting up from sitting posture, then walking normally, but whenever he's getting up from a sitting posture from a chair, he's having a knee pain, anterior knee pain. He will neglect till it is becoming a permanent, difficult problem. So this kind of negligence and I would say lack of awareness is very dangerous. So any sort of bone problem, if somebody faces, he or she should consult at least a basic doctor for his or her problem.
Doctor, but sometimes we are confused whether it is just a muscular pain or just a simple over-exercise or exertion pain. So we don't know the difference between a bone pain, a muscle pain, a nerve pain. So how are they connected? How are the bones and muscles connected?
Basically, what bone is? The bone is meant for the maintenance of the structure of our body, and muscle is to move the joints. These are the basic functions. So there are many joints in between the bones so that we can move the different parts of our body. And these joints are being mobilized. These joints move with the help of the muscles. The mobility factor and the joints are the fulcrum of movement.
You mentioned that a lot of pain starts with aging. I'll
Yes.
refer to that and I'll come back to the younger persons. But what we call it as arthritis, or we call it osteoporosis, or we call it gout, or just wear and tear. How do how does it affect us? Who's at risk? Why does it happen? It doesn't happen to everybody, but it does happen to many people, particularly women. Who's at risk?
These all are different entities. They don't occur simultaneously. So, as you said, there's a gout is a specific disease. The degenerative joint disease or arthritis, that's a separate issue. Arthritis, as we call it, has got again two broad divisions. One is inflammatory arthritis, and another one is degenerative arthritis that happens with overuse and age. And these are totally different entities. Some are related to movements. Overuse of any joint may cause arthritis of that joint. Most importantly, hips and knees, because these are the weight-bearing joint. They are most commonly afflicted with arthritis. Also, ankle. Ankle also has got this weight-bearing ability, and it has to undertake a lot of weight in the activity that we do on a regular basis. Similarly, the gout pain afflicts a certain set of joints. So they are related to those joint pains only. So there is a distinct differentiation, but obviously you have to come to a doctor to know them. The moot point is that whenever there is a pain in and around joint or bone, don't neglect it.
The joint degeneration, I'm taking one example. You have cited with lot of examples. I'm taking one. Say joint degeneration. Joint degeneration or wear and tear of the joint, it occurs with age, with usage of the joint. And the joint surface is covered with a material called cartilage.
Right.
This cartilage is a smoothing agent as well as a shock absorbing agent. Just like the rubber of the car tire. So the car tire, when it is new, every person, whenever going to buy a tire, the tire company gives them a particular mileage set. So for a say a Bridgestone tire company, they are giving a tire of 50,000 kilometers. So apparently that tire will last for 50,000 kilometers. So the cartilage is like that. Some person has got a good quality of cartilage that will last say 80 years, and one person has got a cartilage which is relatively weaker in nature and that will last up to 50 years. So that person who is having a good quality of cartilage, he will not have symptom till the age of 70, 80 years. But a person who has got a relatively inferior quality of cartilage will have the symptom at the age of 40, 45, 50. So that explains.
So is it, doctor, that's a lovely explanation. So is it because something we do wrong, or is it congenital? Are we born with good cartilage, or do we make some errors in our movement or in our posture or in our habit?
There are both the factors, but the predominant factor is genetics. Cartilage structure is completely dependent on the genetics, but on that, bad use, overuse, injury, diseases that can modify the course, but the predominant thing is what cartilage you have born with, you can't change that.
One more question, doctor. You mentioned you're referring mostly to people with age or aging degeneration. But of late, we find many young people, 40s, 30s, mid-30s, complaining of neck ache, backache, middle back, even lower back is so common among people. Why is that happening to younger generations?
A computer-related work, a person works on a particular chair or a position for hours together. Sometimes it's 10 hours, 12 hours together. And this bad posture of work and long sitting makes this kind of problem in younger age. Secondly, the mobile phone, usage of social media, time and again for longer period, looking at the phone with a bent neck causes a lot of neck pain. So these are very new addition to the society and newer problems.
So what is the distinction when a simple strain is really something more serious? Is there any red flags we should know about?
If it is 1 day problem, I have taken a rest, next day it is fine, and then after say a month of gap, it is okay. I can accept it as a strain. But if it occurs regularly, if it doesn't go by taking only rest, it is persisting in a low-grade fashion, then it is not a simple muscle strain or something like that. You have to be cautious about that and you have to go to your doctor.
When you mean doctor, that's another question. We don't know where to go. So we go to our first, local, the resident colony doctor. He may be just a physician. We have we don't know the difference between an orthopedician, a neurosurgeon, a spine surgeon. How do we choose the doctor?
You do not need to go to a specialist from the very beginning. You could jolly well go to your physician, to your family physician, to your general practitioner, and he will guide you where you should go. Don't try to find out, well, I have got a neck pain, so I should go to a neurologist or I should go to an orthopedic surgeon. You jolly well can consult your family physician or house physician. That's good enough.
The vitamin D deficiency, how important is that in our bone health?
Vitamin D is a relatively new vitamin which has now been described not as vitamin at all. It is being described as a local hormone.
Okay.
Because it is vitamin is something which is to be supplied from outside. Vitamin D is something which we can produce in our body as well. It has got two sources. One is dietary source, and second source is we can produce vitamin from sunlight on our skin. So nowadays we are classifying it into a local hormone, and this has got its activity practically on all systems of our body. That vitamin D is something which we usually do not get properly from our diet, because vitamin D, the main source of vitamin D is fish oil and fish products, and fish products, that huge amount of fish products are not being consumed in our country. At least in our part of the society in Bengal, we are big fish eaters, but even then we do not take that much of sea fishes, because the fish oil and vitamin D sources are mostly from the sea fishes. So if you have to have a proper vitamin D level, and if you have some vitamin D related symptoms, you consult your doctor. If you diagnose to have a low vitamin D, you must get them corrected and take a proper dosage of vitamin D.
So that's thank you for that information, because we assume that India is a sunny country, and with sunlight we would automatically have enough vitamin D. But I guess that is also a myth. Is that
this is not exactly a myth. We could get that, but for that we have to have a proper way of sunbathing that Western people take. But in our sunbathing is practically sunburning, and our sun is very hot sun. So we can't tolerate the sun rays that much. So practically we can't get that time to produce vitamin D in our body with sun ray. If you can properly expose your body to sun for proper timing, definitely, theoretically it is possible, but it is not practical.
Thank you for that information, doctor. Which means there are other options for treatment. If I go to a surgeon, he'll say surgery. If I go to a physician, he'll say medicine. Or even physiotherapy, I would like to start with conservative. So what are the variety of treatments, and how do I select whether I want, if I want to avoid surgery initially? When should I really ultimately succumb to it? Can you throw some light on the various options and the various reasons why I should choose them?
A physician will give you only pills and medicines. That's fine, because physician is trained to do that only. But physician could diagnose a surgical problem as well, and he can guide you when you need a surgery. Similarly, a surgeon who is trained to do the surgery, he also knows which problem is cured by the medicine. And he, if required, will give you medicine himself, or will send to a person who can treat you with medicine. So it is not always that demarcated. Well, so it's a overlapping science. We have divided these super specialties. Our body doesn't know that. So after all, it is the well-being of the patient, in which a patient is better is the best way of treatment. That may vary from person to person. A same pain, just for an example, a back pain which is radiating or going down towards the legs could get better with some sort of physical measures, with some medicine in one person, and with same kind of problem, the other person may need a spinal surgery.
Okay.
So it depends on the person, not always on the disease. It is a very complex subject. The pain threshold, the pain tolerance, the pain perception, it varies one person to others so vividly that same kind of problem can be treated in a different manner for a particular person. So it varies from person to person. It is a very customized treatment, and it depends absolutely on definitely it has got a role to play with the pathology itself, but it is also dependent on the person who is suffering from.
And what about physiotherapy? Does it have a role in primary cure or care?
Physiotherapy, as the name suggests, it is physio means physical and therapy is treatment. So it is something in which the chemistry doesn't take part. Only the physical properties are being used to get a relief or get a betterment. So physiotherapy has got two different modes. One is applicative physiotherapy. Like the commonest applicative physiotherapy is hot compress. This hot compress is a home remedy for ages. From our childhood days, we have seen our grandparents to take hot water bag, hot bath, different types of fomentation, etc., etc. These all are home generated physiotherapy. So now this branch has got a lot of applicative therapies like ultrasound therapy, laser therapy, different types of infrared, different types of radio frequency, this lot of things. And the other part is basically guided mobilization. That is mobilizing therapy for, say, a person who has got a stroke, a brain stroke, one part of his body is numb and paralyzed. Gradually, his or her brain function is improving, but before this recovery of neurological symptom, his or her joints and muscles shouldn't get stiffened. So the physiotherapy will make the mobility of the joint muscles so that when the nerve actually recovers, he can get back his movements. So this is what the physiotherapy in a nutshell.
Does physiotherapy replace any of the other treatments? Can it, or does it have its limitations?
It cannot replace, it should supplement. It should supplement.
So when you talk about supplementing, and a lot of things happen in knee replacement, hip replacement. So is it primarily surgical cure, or is it a combination with the PT included?
all replacements are surgical cure, no second thought. You can't replace your joint with a medicine, at least till now. So when you are going to replace something, you have to put something inside. So you have to take the old one out and you have to put a new one there. So this new one is a man-made replica of the old one.
But as a person, as a patient, we are always scared of having our body opened up, particularly the bones and joints, because we're afraid also of something that we call nerves, and we're scared we'll get paralyzed. So what are the precautions and preventive things that we should be aware of during, that you cannot postpone any longer a knee replacement or a hip replacement?
So if you have a knee problem, it's basically, say, a knee joint degeneration has started at the age of 60. A person is having a knee problem around 60, 65 years of age. So from that point of time, there is a race between his lifespan and his knee span. If the life is longer, then at some point of time, knee will not be workable anymore. In that point of time, if he want to get back his movement, he or she has to go for a replacement. It is as simple or as complex as that. So if a person has got a smaller lifespan and he manages to protect his knees with exercise and some sort of other therapies, so that he can cover his lifespan with his old knees, he will not require a replacement. That's it.
And what about the spine? The knee and hip seem to be relatively a little away, but what about spinal surgeries? What about for the neck?
Well, spine is still not replaceable. We don't have a ready-made spine to replace it, but works are going on. There are parts of different types of spinal joints on which this kind of work is going on.
What about neck and cervical discs?
There are discs, there are facet joint replacement, different types of works are going on, but they are very still in a very primitive and nascent state. It will take, I guess, a longer time. But spine, though it doesn't require replacement, but there are mostly with age, the spine becomes unstable. And this instability causes different kind of degenerative pain. So there are many methods of stabilizing spine with different types of internal implants.
Thank you for saying that, doctor. That's true. So, and you did mention that just before this, that with other measures and we can improve joints, which means is fitness or exercise. Can you throw some light on the appropriate, fitness? Sometimes we just overdo it and end up with a sports injury. I'm not talking about that, but how much should we do and how much should we not? And what should we do? Is it age appropriate? I mean, a daily lifestyle or a daily fitness regime?
I would say that it can definitely improve our bone health and muscle health. And what can improve is that we have regular activity. We don't idle away our time. We let our muscles have loading exercise. That means weight training of muscles, maybe 1 kg, but if you do loading exercise of your muscle, that will gain you immensely, much beyond that 1 kg. And when we train our muscle, the muscle also has got anchorage in the bones. So the bones also get like in a state of tension, and that trains the bone to gather more from your body. It is like signaling of internal signaling of the body that tells where the nutrient should go. So the when we train, whether it is aerobic exercise, which is for everybody, whether it is strength training and weight training, again, not for old people. I would not suggest somebody who has already got a weak back to weight train indiscriminately, but you can benefit from weight training and aerobic exercises These are two broad classes that we separate that can benefit anybody. Adult, of course. I'm not talking about kids, adults in getting a good muscular health as well as a good bone health. And obviously, nutritious food would do even better.
So if you had to give 3 good tips to all of us, irrespective of age, to protect our bone health, to prevent injuries, and to, even if we do have it, to halt the degeneration, what would they be, doctor?
So, sort of take-home message.
Yes.
So, stronger bone is the key to a long life. So, if you have to have a stronger bone, you have to have an active life. If you have to have an active life, you have to have a good food, a good exercise pattern, and you have to leave all your bad habits like smoking, alcoholism, others. So a good balanced diet, active exercise, full life could lead to a good bone health, and a good bone health can lead to a long life.
At all ages, and particularly youngsters, I think they need to take care of their posture and the amount of hours. We cannot avoid the number of hours we spend digitally, but I think there must be some precautions when we are looking at screens and phones. Can you throw at least a couple of lines on that, doctor?
So thing is that we can't avoid in digital world, this digital world, we can't avoid using computers or mobile phones, but we have to use it judiciously. That is very important. We have to use it properly. There is a term called ergonomics. For all work, there is an ergonomics. So computer itself has got its own ergonomics. We should follow this ergonomics. For example, the chair in which a computer worker should work has got specification by the computer ergonomics. It should have 6 prongs, it should have a height adjustment, it should have a armrest adjustment, have the spinal support, should have a neck support. So far, there are a lot of things. There are ergonomic keyboards. Normal keyboards usually incline from front to towards the computer upwards. Rather, the ergonomic keyboard is a reverse designed keyboard. They are slightly more costly, but for a person, if somebody wants to have a good scientific usage of computer, then he can jolly well buy a ergonomic keyboard for himself.
Right.
The second is most important is eye leveling. The computer screen should be at the level of the center of your eye. So exactly the way we have placed our computer right now for this arrangement.
Thank you, doctor. Thank you to both of you so much for helping us today. We really appreciate the advice and the mythbusters you did. I think I'll go back with less fear of surgery or treatments and go to the right doctors. We did not have time today to talk about injuries, falls, or trauma, because that's a vast subject. But on
Yes.
general bone health and degenerative, and even for youngsters, we appreciate the inputs, and I'm sure all our consumers, all our patients would understand this topic better and begin attending and presenting your symptoms in time to the right doctors. With all the luck for a long life and longer bone life. Thank you once again.
Thank you.
Thank you. Thank you.
These doctor-patient conversations are brought to you by 𝐏𝐿 and Patients for Patient Safety Foundation. 𝐏𝐿 is the consortium of accredited healthcare organizations established to promote quality, patient safety, and accreditation. As healthcare providers, we wish to partner with patients and educate them about the common disease conditions, symptoms, so that they become empowered partners. Towards this, we have partnered with the Patients for Patient Safety Foundation to bring to you doctor-patient conversations.
Thank you, ma'am. Patients for Patient Safety Foundation, established, as you know, by 𝐏𝐿, focuses on patients, families, caregivers, and lay people who are unaware that they can engage and provide equal partnership in healthcare outcomes. We do this by creating suitable, simple patient education material which highlights early symptoms for early detection and better cures, including the risks and consequences if these are ignored. But there is hope because we also provide tips for actionable protection and preventing of all such harm. Towards this, we bring you this series of conversations which addresses doubts and fears that lay hidden in a patient's mind, but experts, doctors clarify these, providing well-timed information for self-engagement. We do hope you build this partnership with the healthcare providers, and remember, our health is our responsibility. Thank you, and keep watching these episodes.